Life after colostomy. That is the topic today we are going to discuss. Most of the people may not know what is colostomy. Colostomy means colon means large intestine, ostomy means opening. It's a surgical procedure done for some reason. What is that? Most of the people may not know exactly what it looks like. It is like keeping the motion exit in the abdomen wall, in the upper abdomen wall. So the motion comes out to the opening where it's collected in a bag and can be disposed of. That's called colostomy. So it's done as a temporary procedure or permanent procedure. So usually people would have seen people undergone for cancer surgery where they kept the bag outside to collect the motion. Is it temporary or permanently? So cancer is one major surgery where the colostomy or even ileostomy. Ileostomy is where the small intestine is kept outside. So it could be permanent or it could be temporary. To give an example for a permanent colostomy, suppose somebody has a cancer in the rectum, the lower rectum part, and we have to do a surgical clearance. So that is where they are nearby the sphincters. Sphincters are the one which voluntary controls the motion. Suppose somebody is talking to you and you feel like passing motion, but you can control it. That sphincter is damaged during the uh, surgery, the cancer surgery. So they cannot hold it. So continuously they will be passing motion. That is impossible to live. So what we do is we divert the motion through the anterior abdominal wall through a permanent colostomy where it's collected in a bag. The bag is also disposable bags are available, permanent bags are available. In a permanent bag, whenever it fills, the bag is full. They can go to the toilet or in the bathroom and empty, and they can continue their normal life. In a disposable bag, you can just dispose of whatever the content and change the bag. So this is one. And temporary colostomy, that is done most of the time in trauma or in an unprepared bowel. Suppose we are doing a surgery for the cancer, the same cancer, but the bowel is not prepared well or is done as an emergency obstruction, emergency, where there are a lot of the motion will be there. So if we do a cut and we join the intestine, the motion will be giving infection and it disturbs the suture line. So the sutures get damaged and it can open again, causing a lot of complications. To avoid the perforation or the suture line leak, we do a temporary colostomy. So suppose the colon the sutures are done just above the level, we divert the motion. That's called diversion colostomy. So the motion will come just proximal to the suture line. So the distal to the motion area, it becomes dry. So it's not disturbed, no pressure, no motion, no infection. So the healing is very fast and the suture lines gets easy and closes very nicely. So once that closes, the doctor decides, usually it is few weeks or even sometimes few months. After that, it will be the diversion colostomy will be closed. So like a temporary colostomy. So the temporary colostomy sometimes or even permanent colostomies are done mostly for the cancer, then trauma, accidents, and irritable inflammatory bowel disease like Crohn's, ulcerative disease, or even sometimes severe infections. We do that. So what happens with that colostomy? What the life after colostomy? Most of the time, the problem is acceptance. The patient cannot accept even before, sometimes before the surgery, when we say you may require a temporary colostomy or a permanent colostomy. Even for temporary colostomy, they will not accept that. They even say, don't do the surgery, I don't want the surgery, or they will beg us to you do without colostomy. All these things, the acceptance is very very difficult to accept it because they think it unhygienic, the smell, the motion is somewhere, the what other people will think. These are the things will run in the brain, the mind. So they'll the acceptance, then self-concept. They will always when we do the colostomy, they'll be self-conscious about their colostomy. So what others will say, what others will look, even what the family members think, they don't want to do, look upon, a little in a sympathy kind of thing. So they are self-conscious about the colostomy. So they can be depressed, they can be frustrated, they'll be, most of the time they'll be irritated more. Then these are the things. Then sometimes the complications can even occur in the colostomy site. Sometimes bleeding will be there. Sometimes even immediately hernia can happen, or in a long term. Generally, in a long term, people in the permanent colostomy, people gain weight as they get older. The hernia in the colostomy is very common, and usually it will be treated like a hernia surgery, or even with the redo or refashion the colostomy. So people can have a very normal life, very 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 normal life. They can have a normal diet, especially initially, maybe probably some couple of months, probably they will ask you to avoid that can cause diarrhea, like or anything gas producing diet, anything gas producing they will ask you to avoid. Even sometimes fibers they ask you to avoid. But after that, you can have a very normal diet and normal activities. You can go to the office, you can go to travel, you can go to anywhere, and even they can do exercise. Of course, certain exercises are prohibited, like too much of heavy work and all not available. Even sports activities are allowed. They can do sports activities. Even with the nowadays of modern colostomy bags and other things, they can even go for swimming. So this is very. I have a patient who was been for more than 27 years, 30 years, on colostomy, permanent colostomy bag, which was done before his marriage. Who got married, having children. He goes to a vacation everywhere. He is having very normal life. So colostomy is a surgery where the colon, or sometimes even the small intestine, either temporarily or permanently kept in the abdominal wall where the motion comes, and they can have a very normal life. Even suppose after that, so for some reason colostomy, they want to do a colonoscopy, we can do colonoscopy through that. So colostomy nowadays is done for mostly for the cancer. It can be for trauma, it could be for infections, or it could be for inflammatory bowel disease. But it's a life-saving procedure, so easy to accept and easy to live with that. So, so most of the time, the colostomy care nurse or colostomy care person, usually they will come and help you. Initially, they will come and teach you how to use the colostomy, how to clean, how to change the bag, how to take care of it. And they, most of the time, they will psychologically they'll boost the moral of the patient. Like they will say, so I have seen so many people, he's doing he's going for vacation, he's doing go to the job, he's earning money, so nothing to this or nothing. So they are the prime people who can boost up the moral of the patient. So colostomy nurse, caretakers, they are very important, because they usually teach not only the patient, they also teach the family members. So colostomy is a procedure, it's a life-saving procedure. So nothing to worry about it. Thank you.